It's time now to take a look at stories making the headlines in Nigerian newspapers. I have with me in the studio in-house analyst Obaniyi Akinwale. Good morning.
Good morning.
I wonder what the level of compliance was when you were coming to the office this morning.
100%.
100%. And you saw the security personnel on the road.
My security, my essay was even saying, "Where are you going, sir?" I had to show him I'm a policeman.
Interesting. The same as I was coming this morning to the office, the level of compliance was indeed 100%. Let's head straight to the papers this morning. And I begin with the news direct. COVID-19, Governor Makinde tests positive, remains in self-isolation. Nigeria reports second death. Senators donate half salary each. Ogun, Lagos residents flood markets, ATMs ahead of lockdown. First Bank donates 1 billion naira, reiterate commitment to safety of Nigerians. And then we move to the Daily Trust. Experts want more Nigerians tested for COVID-19 as federal government searches for 6,000 contacts in Abuja, Lagos. We've tested 2,000 so far, NCDC. Oyo governor tests positive. My experience at isolation center survivor. And this is the point I'd like for us to start talking about the level of testing. So far, the NCDC is saying that it has tested only 2,000 persons. They are in search of 6,000 persons, talking about contact tracing in Lagos and Abuja. And we have about 25,000 kits. When you place this side by side, our population, just 2,000 persons tested so far, and we are still trying to search for others. I wonder how concerning this is for you, seeing that we are trying to curtail the spread.
Actually, with every sense of responsibility, I want to say a very good job done by the NCDC guys. It is not easy for a country like us, where you don't easily go by any database of where people live, their means of livelihood, their movement pattern, no security measure, no social security pin or what have you to trace people. Even as at that, looking at a country whereby it is very rare to get a primary health care center in a neighborhood. So for NCDC to have been able to test 2,000, given the fact that we only have 5 molecular testing labs as at before yesterday in Nigeria, I think that is kudos to them. On the other side, unfortunately, we don't seem to have the kind of awareness where people have malaria and go to hospital to do medical checks. People rather go to the local seller on the street. So that creates a lot of issues in terms of how people are being tested, and the panic in the system also creates a lot of apprehension to say, okay, if you have cough, if you have cold, even in the office now, if you sneeze, the way people will pick rays away from you, you'll be shocked that I didn't know my colleagues. So I give it to NCDC, but like I mentioned in one of our discussions last, I said, I don't expect banks or multinationals to be donating money. I would rather advise them to go the way of GTB, whereby they will be buying those facilities. Let's go and get those test kits and make it available to private hospitals so that people can walk in. I heard of a case whereby a private hospital in Lagos where the patient was showing symptoms of malaria. Immediately they brought him to the hospital. The nurses, the doctor took to their heels, said, this is corona, go to Yaba. So if we have to whereby those donations are used to buy those kits and they make it readily available for people, I'm sure it's going to relieve the body on NCDC. But for now, for me, looking at people putting their life at the front of the battle, the NCDC guys, the guys in Lagos State, in Oyo, Osun, and what have you, I think I'll still give kudos to them.
But some have complained that the process of getting tested is one, cumbersome, and it seems is for a select few. We have seen complaints even across social media, and some persons saying this.
You can't rule that out in a democracy like ours. I was telling a friend of mine immediately after the election, I said, if you eat your dinner before your lunch and your breakfast, when it's time for dinner, you have nothing to eat. What you find out is that people just after politicians to ask for money, T-shirts, vests, what have you, when they are supposed to invest in our health facilities, in our school, in basic amenities. So what you find out is that when politicians get to position, is we first and first. So naturally, it is so saddening that when you find out the people that are being tested, they are high-profile people, the governors, the senators, the House of Rep, the who is in government, the directors, and what have you. So unfortunately, out of about 200 million, possibly about 10,000 exposed. We've only been able to trace and test 2,000, which our nine knows that chunks of those are people from the villa, from the governors' forums, from the senators and House of Rep. It is so unfortunate, but this is an eye-opener to all of us as Nigerians that when election period comes around, we don't just run after these guys. By now, I'm expecting us to ask each House of Rep that collect consistency allowance that, what do you do with those money? Each senators that collect their senatorial allowances, where are the hospitals, where are the basic amenities, so that when we have issues like this, we don't need to be running to Ede or running to Yaba or running to Lut, but we can easily go to nearby hospitals to have this done.
But the same people have come out to say that we are going to donate 50% of our salaries at this point.
How much is their salary? You and I knows that the salary in Nigeria basically sometimes about 40 or 30% of your total earnings. These are people that hence allowance of about 300%, 200%, newspaper allowance, home domestic allowance. Why can't they need everything? And I'm putting challenge to the House of Representatives. It costs them nothing to convert the newly acquired Camry cars to mobile ambulances, so that people will know that you are there to represent them. Instead of you wasting 360 Camrys, why don't you turn that money and buy mobile ambulances that you can equip with ventilators about $10,000, $15,000, and you are buying a car of about $25,000 to $30,000. So I'm sure if we channel our resources to right places, I am sure things can be done better. So for me, I will still keep on appealing to our people. I'm appealing to NCDC. Lagos State is trying, there's no doubt about it. They've been a trailblazer. That please, let these donations used to buy these test kits and let's make it available for private hospitals, nearby hospitals, because the queues, I was watching a video online this morning where a man said he's going to create sin. His wife has been tested, his wife is already showing the symptoms, but she's not being treated at the isolation ward. So the challenge is that I brought her here to come and be tested and be treated, but she's not getting the attention.
So that could be another challenge that we might be facing.
Absolutely. A lot of people are facing that. A lot of people are even staying there because the fact that if you go out there and say you want to do tests, the first thing, if you have seen on the messages, is that first find out whether it is malaria, whether it is a regular air pollution cough, then until you now get to a situation whereby you are showing symptoms. Look at the governor of Oyo State. He's not showing symptoms yet. And yet he has been tested that. So they should make this available to Nigerians. So that's why I'm saying all these donations should be channeled towards getting this kit so that we know how many people is already infected with this virus. And again, it is high time media begin to enlighten people that getting tested positive is not a death sentence. If you get yourself tested, you are tested positive, and immediately you start your treatment, you do what you are supposed to do, the survival chance is more than 80%. So if all these donations from all the banks, multinationals, let's channel it towards getting this test. So we'll know the number of people that need this testing and what have you. And kudos to Ogun State Governor yesterday, converting a model school to an isolation center. It's a laudable achievement. Osun is doing the great times. And again, maybe this Quran is also a blessing in disguise for us in Nigeria, because you find out before now the number of ventilators you have in some state. I was reading an NMA report that even the whole of Abuja, you may not be able to get to 10 or 15 ventilators. So yes. Now that we have these issues, multinationals and what have you are donating ventilators, respirators, ICU kits and what have you, maybe it's a blessing for us to be able to re-energize our health facilities. But saying all that, what I'm appealing to our donors again is that don't give us money. Let us get those kits and make them available, because it is easy. Why are you
hammering on that aspect?
Our history with fund management is very poor in this country. We can't, as we speak today, we have never, except maybe for Lagos that give us budget performance and what they have done on CAPEX and OPEX, we don't know how much is coming in terms of our oil revenue. We don't know how much we are spending. We don't have those data and statistics. So is it not better to have something like what you validated? You can see the number of 1,000 beds with few number of isolators and what have you. So when Jack Ma brought his stuff, we saw it here. So there's nobody. So let them order. I am afraid we don't have the capacity to efficiently manage those funds. Let the donors be buying us ventilators, respirators, bed, provide quality health facilities, nearness, mobility, and also protection and the welfare for the health personnel that are on the front line.
Do we have the health personnel, that capacity to handle all of this if we buy all of the equipment and all? Because that's another concern for some persons.
Sincerely, yes, when World Health Organization was carrying some research and some training on this coronavirus in China, the NCDC Director General was one of the selected 11 that was there. And that tells us that we're not only there, but we're on global map. I will tell you without missing word, the first delivery, twice delivery sort of, when the baby was removed from the fetus, was treated, was turned back to the wombs, was done by Nigeria and USA. And we have the people doing these wonders. I can tell you for free that given the condition we have.
That is outside Nigeria.
In Nigeria, we have over-competent doctors. You remember Dr. Adadavo, he's a Nigerian.
Yes.
He stood for the grant, and you remember when the Ebola had, we did not have to go and import doctors from America, from Europe, to help us stop Ebola. And even so far, so good, African countries, a couple of years ago, I heard AU sent about 100 doctors down to Nigeria to come and study how Lagos State is curbing the spread of this virus. So I am very, very sure that we have the capacity, we have every capacity by our doctors to get this done. Well-funded, well-trained doctors are in this country, but the problem is that the facilities are not available. So I hope the government will now begin to see that we have the capacity from our team to get this whatever is being called sorted out at the earliest part. And please, the doctors should be incentivized at this moment. They are putting their life at risk. They have family, they have children out there, they have works out there. Government should please ensure that they provide necessary PPE and provision for their family. Again, it is not too much like people are clamoring for. People that are doing daily jobs that are being asked to go at home, if it is 50,000 naira for this period of 2 weeks, federal government should look into giving people money so that
the government
people don't
has
stay
talked about that in the president's statement.
There is something like that. He said he's only going to do. He's going to give moratorium on anchor borrowers' money, market money. But he has not said what happened to that weather that is going to be indoor. That Okada man,
vulnerable.
that woman that sells pepper, the barber, and what have you. So I believe government should do something about them as well.
All right, we'll leave it here now. Obaniyi Akinwale, thank you for speaking with us.
Leo.
To take a look at stories making the headlines in Nigerian newspapers, I have with me in the studio in-house analyst Obaniyi Akinwale. Thank you for joining us on TVC Breakfast. All right,